Welcome, everybody. It's 6:30, so we're going to go ahead and get started. Thank you guys for joining us tonight for the Women's Heart event virtually this year. I'm going to go ahead and introduce our speakers for tonight. We have Dr. Kawaja and also Kay Francis for the comedian afterwards, so make sure you stay on to see her. So Dr. Shazib Kawaja is a board certified cardiologist in cardiovascular disease and interventional cardiology by the American Board of Medicine and serves as a chief of interventional cardiology for Tanner Health System and medical operations leader for Tanner's Heart and Vascular Services. He earned his medical degree from the University of South Alabama. After completing a residency in internal medicine at Albany Medical College in Albany, New York, Dr. Kawaja completed a fellowship in cardiovascular medicine at Dartmouth Hitchcock Medical School and an interventional cardiology subspecialty fellowship at the University of Minnesota Minneapolis Heart Institute. Dr. Kawaja also received advanced training in peripheral vascular interventions at the Arizona Heart Institute. He and the team at Tanner Heart and Vascular Specialists provide a range of services for patients with heart disease and other vascular disorders, offering state-of-the-art technology to provide high-quality comprehensive care. Kay Francis, our speaker, has presented in 49 states and Canada since 1984. As a professional stand-up comedian, she lived in New York City for 4 years, appearing in the nation's top showcase comedian clubs. She has a degree in health and education and an MBA. She is the author of The Funny Thing About Stress. Kay is here to remind us of the importance of managing the stress and taking care of ourselves. So sit back and relax and prepare to laugh while you learn. She is broadcasting all the way from Wilmington, Ohio tonight. So please make sure you stick around to hear her after Dr. Kawaja. But Dr. Kawaja, you can begin whenever you're ready.
Great, thank you. Welcome, everybody. Good evening. Just a clarification, I'm not the comedian, so we would start out with women and heart disease. This is a 15-minute talk, but really could take an hour and a half. So we'll try to limit us to about 15-20 minutes. In terms of women and heart disease, we would talk about the issue itself, which is cardiovascular disease. We'll talk about the symptoms of heart disease, risk factors, prevention, diagnosis, and then treatment. And we'll try to touch briefly on each one of them. So when we talk about cardiovascular disease, this is cardio and then vascular. And cardio involves essentially heart. And there are two different issues that we have with cardiology or cardiac issues. We talk about coronary artery disease, which is the most prevalent issue that causes death. In addition, we have heart failure, we have arrhythmias, we have angina, which is a chronic state of chest discomfort, myocardial infarction, as called as heart attack. We have the cerebrovascular disease, which are strokes, near strokes. We have claudication vascular disease involving the leg blood vessels causing pain when people ambulate. We also have aneurysms and plaque buildup at different vascular beds. And all of these are very prevalent in males as well as in females that do cause significant morbidity and mortality. So it's very important to discuss these. As we talk about cardiovascular disease, this is the biggest killer for females. It causes almost close to 400,000 deaths a year. If you think about total deaths from coronary artery disease, which is essentially heart attacks or sequelae of it, of coronary artery disease, that's close to about 176,000. In comparison, 39,000 deaths from breast cancer occur every year. When we talk about heart disease, since 1984, cardiovascular disease has killed more American women than men each year. So it's fairly prevalent. It's not talked about a lot. When we look at the statistics, 1 woman dies every minute from cardiovascular disease in the United States. When we take that in perspective, 1 in 2 women will die of heart disease. This is in comparison to 1 in 30 women will die of breast cancer. So this month, especially, we talk about that, but we practice it every day. And I think the purpose of the talk is to make us more aware of heart disease, the symptoms, how to prevent it, what to look for. So this is a little diagram of prevalence of heart disease and cardiovascular mortality in different states. When you go from light pink to red, the mortality increases. So if you notice where this is concentrated, especially in a very dark red box right here, and you can see the prevalence of heart disease is very, very common in these states, and especially when you look at Georgia and you look at the counties that we live in, it's very prevalent, and mortality is high or higher than the rest of the country. And almost a decade ago, I remember giving a talk very similar to this, and we talked about mortality at that time. Georgia mortality was about 11% higher than the national average, and our counties, our neighboring counties, this mortality was much higher than the state average. So it's very prevalent. It's gotten better, but certainly high, and I think we need to keep working on trying to make us more aware of this and treat it. This is an old slide, but I wanted to put it out there because it's very similar to what the data now is as well. This is prevalence of cardiovascular disease in Americans age 20 and older by age and sex. Red are men and white women. So if you look at the early years in the teenage and then 20s and up to 30s, 40s, you can see the prevalence of cardiovascular disease is more in men than women. And as you reach about 65 to 74, you can see that this prevalence is almost equal. And then as we age higher, 75 or above, it's higher in women than in men. So it shifts, it changes. There's the shift that occurs around this age group. When we look at mortality in younger women, so if you go back to this slide, obviously the prevalence of disease or the how common the disease is less in females. But when we look at the mortality of cardiovascular disease, especially in younger women, women under 70 suffer the highest relative sex-specific heart disease mortality. So look at the men in this bluish purple, and then in burgundy women, and you can see the mortality as you go through age quartile. You can see the mortality in men is lower than in females, and as we reach up here, you can see it almost equals, and then slightly higher in men than women. So women would have lower prevalence of disease in their younger years, but higher mortality associated with cardiovascular disease. This is the trend for males and females. Again, an old slide, but I'll have a follow-up. So this slide here talks about the cardiovascular mortality for males and females. If you look back into the late 70s, 79, and this goes all the way up to 2001, in males, the mortality for cardiovascular disease was on decline. If you look at females, this was essentially flat, if not maybe slightly higher. And there's another slide that I could not find, but I can tell you that both of these graphs plateaued in about 2001 and then started to decline. And it is obviously declining for both males and females, but the prevalence and the mortality itself did tend to be higher, and the graph for females started to come later than males. And that has to do with a lot of things that we'll talk about later down in the presentation, but has to do with how we diagnose what symptoms females have and why the presentation to seek medical help is delayed in females. So when we talked about cardiovascular disease, we mentioned coronary heart disease, which is essentially plaque buildup in the blood vessels, and morbidity and mortality associated with that. So that would be essentially heart attacks that may be associated in those patients. But there are other disease states that cause cardiovascular mortality, morbidity, and mortality. There are obviously strokes that we talked about. There's congestive heart failure, weak muscle, heart blood pressure, diseases of the artery. So that would involve in the leg vessels or other places, rheumatic heart disease and congenital heart disease, which is a small fraction of that, but increasing, and then other miscellaneous causes related to that. This diagram here shows what the plaque buildup, what atherosclerosis is. So this is the inside view of a blood vessel, three-dimensional. And this is a normal blood vessel wall up here. And when we look at this blood vessel and do a cross-section analysis of this blood vessel, we can see This yellow part, this is all plaque buildup. So these plaques are present in different places in blood vessels and may progress with time. And this plaque, as it grows, it has a lipid-rich core inside it, which is the bad actor. And when it ruptures like a volcano, it can cause eruption and can close off the whole blood vessel and then hence lead to a heart attack. So, our emphasis is really focused in patients with coronary heart disease, which is, as we talked about, the worst actor, the biggest reason for mortality among females and certainly among males as well, is to really treat atherosclerosis aggressively. When we look at blood vessels, when we look at the early blood vessels, the normal coronary arteries, there's really no plaque buildup inside these blood vessels. Then we start seeing plaque buildup with time, and that can happen as early as now the studies have shown as early as in the 20s or so, and it progresses with time. And this plaque buildup can be progressive, and sometimes these plaques can rupture. It's almost like a volcano, and if it ruptures, it causes a clot to develop, bleeding to start, and bleeding is stopped by internal particles and platelets, and they would come and form a clump, and that would close off the blood circulation in that blood vessel, and then leads to heart attack. So also there's a condition called coronary spasm that can happen and cause a restriction of blood flow, and certainly can lead to heart attacks as well. So this is a diagram showing how the heart attacks happen. This is a blood vessel, and you can see here, it's initially there's this yellow plaque on the left, and this plaque can grow with time, and certainly this plaque can sometimes break off and erupt and cause obstruction of blood flow, shown in black here. And then as that blood vessel to that muscle of the heart shuts down, it causes necrosis, it causes lack of blood flow, necrosis, and then that leads to muscle damage there. So a lot of what we would do, especially if patients coming in the stages where an artery is closed off and causing a heart attack, opening that up would obviously minimize heart muscle damage in those patients. So atherosclerosis, which is it's a Greek word, it's plaque and then sclerosis, like a paste. So plaque buildup. So all patients with clinically apparent atherosclerotic disease, which is essentially any disease related to blood vessels, they require intensive global risk factor reduction. So we need to work on risk factors to control to make it to lower the impact that it causes in patients' lives. Also, some plaques are unstable plaques that we talked about, and these are accidents waiting to happen, and these must be identified and certainly treated aggressively. So why is heart disease different in women? Because presentation is different from how it presents in men. 2/3 of the females who die suddenly had no previous recognized symptoms. Women are also prone to non-cardiac chest pain, so obviously at times it may be difficult to recognize if this chest pain or tightness is truly from the heart or not. In fact, if you look at the data, they may experience little or no squeezing chest pain that is described as in the center or the left side of the chest. They may have different symptoms when they present to the emergency room with their heart attack. There's a study that looked at 515 women with heart attack, and these patients came in, almost less than half had classic chest discomfort. Other patients' symptoms were dyspnea, which is shortness of breath, and almost 60%, weakness 55%, fatigue 43%. And these symptoms can be very non-specific. So a lot of different conditions or disease states can present with these symptoms, and sometimes therefore may be difficult in recognizing as signs of heart attack, and therefore the presentation may be delayed because somebody may think, hey, this is from something else, not from my heart, and they may not come in time to seek medical help. So they may have more dizziness, may have more nausea, indigestion, fatigue than men. They're more likely to have neck pain, arm pain, back pain, shoulder pain as their presentation. Again, having said, these symptoms can come from other diseases or conditions as well, and therefore it causes confusion. So because of these atypical symptoms, females seek medical care later than males, and they're more likely to be misdiagnosed. They may come to the emergency room and their condition may be thought of something else. Women presenting with heart attack and coronary artery disease, they're more likely to be older. They may have history of diabetes, high blood pressure, cholesterol, heart failure, and more unstable angina, or angina is pain coming from the heart in an unstable fashion than male counterparts. So as we talked about, this can sometimes be confusing for anybody, including patients themselves, to seek help. So there are some misperceptions and missed opportunities leading to access inequality. Women are less likely to have an EKG or be admitted to the telemetry floors. They are underdiagnosed, and therefore they may get a false sense of security. When we look at other data, and this is national data, there's less aspirin usage, beta blocker usage, statin, rhythm medications, cath, angioplasty, bypass, and all of this has been looked at throughout the country. So again, treatment may not be as aggressive for unclear reasons, especially in terms of presentation confusion. And these patients may also be less likely to enroll in cardiac rehab after heart attack or bypass surgery. And as we talk about what are the risk factors for heart disease, they are becoming more and more clear. This is, but this goes way back. This was initially studied in 1948 by a Framingham study. It looked at multiple risk factors for cardiovascular disease. Now there are certain more models that would look at risk factors for heart disease and trying to predict which patients may have higher incidence of heart disease in future. So what are some of the risk factors for heart disease? Age, biggest risk factor, one of the bigger risk factors, age over 55. Our cholesterol is another big risk factor. Of the cholesterol panel, the LDL, it's the worst actor. And if you remember the slide I showed you earlier, where there's a necrotic plaque inside the yellow plaque that we showed. And that usually comes from LDL. So the higher the LDL, the more chance that people would develop plaque buildup. In addition, low HDL, which is good cholesterol, and high triglycerides are also a risk factor for heart disease. A family history of premature heart disease is independent risk factors, and which would include males in the family being less than 55 with onset of heart disease, and females less than 65 having heart disease. So if you have somebody with the female age 62, for example, and had heart disease, heart attack, that would be an independent risk factor for having heart disease. Obviously, siblings having heart disease at early age is the highest risk factor, is another high risk factor for heart disease. Other diseases, including diabetes, smoking, high blood pressure, peripheral vascular disease, menopause, obesity, metabolic syndrome, lifestyle that's sedentary, and collagen vascular disease, autoimmune disease, they're all risk factors for heart disease. Now, some of these risk factors are modifiable and some are not. So, your family history, obviously, you cannot change. There are things that you can change and drastically lower the risk of future events. Smoking is a big one. So there are studies that show that if you stop smoking today, within 3-4 days, the inflammatory markers would start coming down, which goes to show that even stopping cigarettes or smoking at any time frame is helpful to lower the incidence of heart disease. So diabetes almost doubles the risks of heart attack. Smoking, as we talked about, is really associated with significant events in females and also in males. And even with minimal use of cigarettes, the risk is increased. 6-time increased risk of myocardial infarction or heart attacks in females versus 3 times in males. So other risk factors we talked about, and we kind of go through these quickly, but low HDL, more predictive than high LDL. There's also another factor that's not commonly checked, but Lp(a). This is another lipid particle that is also an independent risk factor for heart disease, and it's been studied more recently, especially in the last decade or so. It can be more predictive in younger females for heart disease as well. Triglycerides, as we briefly talked about, are also a risk factor. So what happens with diabetes? Diabetic patients develop diffuse atherosclerosis or diffuse plaque buildup. They may have more severe and diffuse coronary artery disease. Their lipid metabolism may be disturbed or may be altered, and that sometimes prones them to more plaque buildup, altered carbohydrates and lipid metabolism. And again, they have the metabolic profile with low HDL and high LDL. And so their symptoms also may be unreliable, may not be classic, and those patients therefore may present late with their cardiac event. So what are some of the sex and biological differences in cardiovascular disease? Women usually present about 10 years later with CVD, cardiovascular disease, than males. There's a higher prevalence of high blood pressure, diabetes, depression, lower incidence of tobacco use generally. And there is a higher relative risk from these disease conditions, as we talked about, as opposed to males. There's diffuse atherosclerosis, so they may have not just one focal plaque, but more or less diffuse plaque buildup. And obviously, we see more incidence of small vessel disease in females, microvascular, and they have endothelial dysfunction, which is a smooth muscle disorder in the blood vessels in the heart sometimes. So I'll kind of skip through some of these here, and let me just get to tests to evaluate heart disease. There are multiple tests that you can actually use to diagnose heart disease. They could be very basic as EKG, which is a very non-specific, sometimes a very sensitive test, but may direct us in some direction. Acrocardiogram, which is an ultrasound of the heart, is used to detect muscle function of the heart. It also is used to detect valve disease in patients. Coronary calcium score is on a rise, and this is essentially looking at calcium deposits in the blood vessels in the heart arteries. And these patients that have higher levels of calcium against their similar age group, they would be at high risk of having a future coronary event. CT scans, coronary CT scans are more widely used now to detect coronary artery disease in select patients. In those patients, a CT scan could help look at the blood vessels non-invasively. Exercise stress tests, there are numerous types and appropriate for different scenarios, but just a treadmill exercise stress test, a stress echo, which is an ultrasound-based stress test, nuclear stress test, a PET stress, and different modalities that can exercise patients to detect and try to pick up coronary artery disease. Cardiac MRI to, again, better quantification of muscle itself and looking for different conditions associated with heart. Catheterization is where we essentially go and look at the blood vessels invasively, and electrophysiology studies, ablation, and these are tests to look for rhythm problems in patients. This is a calcium score. So this is a non-invasive test that is sometimes used to detect calcium, and calcium deposits are as a result of plaque buildup. And these plaques, some of these plaques, as they develop into the blood vessels, they break. The body tries to repair them and deposits calcium. And these calcium deposits in the vessel and the blood vessels in the heart could suggest incidence of plaque buildup. So people that have high levels of calcium would be more likely to have a coronary event long term. So the calcium can be detected with a CAT scan, which is, again, non-contrast CT. So it's completely non-invasive. It doesn't tell you the degree of plaque. It just essentially merely states, how bad or how much atherosclerosis or plaque buildup is. And for majority of these patients, if there's a significant amount of calcium, these patients would be at high risk, and you can then do a stress test depending on their calcium score or other tests to further diagnose. Certainly gives patients and physicians a chance to really work aggressively on risk factors to lower future coronary events. So this diagram here shows calcium deposits in yellow and blue, and yellow here in the blood vessel. This is an echocardiogram and ultrasound of the heart, and this is, again, looking at the heart muscle, looking at the valves, different places. Now at Tanner we have 3D echo, which is a three-dimensional echo, state-of-the-art echo, looking at the valves in 3 dimensions. And again, these are different pictures on these ultrasounds. This is a nuclear stress test, and essentially what that is you're looking at the muscle itself and the perfusion of the muscle. So this is at rest, and then patient is exercised either with medicine or with or physically on a treadmill, and then these pictures are taken, and then we compare the two sets to see where lack of blood flow may be present, and that may suggest that the blood flow may be impaired in certain blood vessel. It does not look at the blood vessels directly, but it looks at the muscle. So it's an indirect test, and that could then suggest that there may be potential blockage, significant blockage in the blood vessel. This is a coronary CT angiography that we talked about, non-invasive CT scan looking at the blood vessel. This is an angiogram or catheterization where it shows that this is a CT scan showing a very nice picture of the blood vessel. And again, used in certain, not in all patients, but in certain patients, this test could be very helpful, very useful to detect coronary artery disease. This is an MRI, which we use here for different reasons. And again, looking at the muscle, looking at the valve, much greater depth than any of the other testing. It's not used for detection of coronary artery disease, but more so for structural heart issues. Catheterization is where you go in and look at the blood vessels with contrast with iodine dye. This is a very tight blockage in the LAD, the front wall artery of the heart, which feeds a big area of the heart muscle. You can see there's a disconnect here. And this is after fixing that and putting a stent in and improving blood flow. So our goal is to really increase awareness of heart disease, and patients certainly, and certain patients are screened obviously for heart disease. Patients, the need for prevention in women is 9,000 US women younger than 45 sustain a heart attack each year. So there's a real urgency in prevention and its substantial benefits to women of all ages. So how do we prevent heart disease? I think just a point I want to make, heart disease is largely preventable. So there are things that we can do to help lower the incidence of heart disease. Exercise is certainly one. Staying healthy, walking, and certainly helps a heart long-term. Quit smoking, and as we talked about earlier, just quitting cigarettes at any age, at any time, would lower the inflammatory markers and inflammation in the heart within a few days. Healthy diet, low-fat, low-cholesterol diet, and certainly we can spend a whole topic on what kind of diet, but certainly lowering your fat intake, cholesterol intake would help long-term. Weight loss, BMI less than 25, waist circumference less than 35, treating the risk factors, high blood pressure, diabetes, cholesterol, and then depression, which causes stress and causes heart disease. So again, we'll kind of skip some of this, but essentially talking about lowering the intake of saturated fats and sodium, eat daily recommended servings of fruits and vegetables, try to eat more omega-3 fatty acids, eat nuts, seeds, and try to eat meatless meals at least a few times a week. If you remember multiplier effects, so one risk factor doubles the heart risk, doubles the risk for heart disease. Two risk factors quadruple your risk, and three or more risk factors can significantly increase the risk more than 10 times. So by just doing four things, eating right, physically active, not smoking, keeping a healthy weight, can significantly lower the risk of heart disease by about 80% or so. So again, a lot of things that are preventable here by just making some choices. So the treatment of heart disease is risk factor modification. I think that's a big one. We can control things. We can try to modify the lipids, the cholesterol, eat healthy, and certainly have a healthier life, which would help us long term. Medical therapy is kind of focused on or based on what condition we're dealing with. Congestive heart failure it's a phenomenal treatment now than before. People are living much longer with congestive heart failure with all the treatment, the modalities that are available. And it's from very simple medical management to advanced treatment for these patients. Arrhythmia management, that's really evolved significantly over time. Patients that have rhythm issues that could potentially be fatal are treated aggressively. Patients that may have atrial fibrillation, which is again a very common arrhythmia, can be treated now with medicines and ablation and other modalities that are available, causes significant lifestyle issues. Coronary artery disease, as we talked about now, great role of preventing heart disease by risk factor modification, and certainly treatment options in these patients, including angioplasty, stenting, coronary artery bypass grafting, and as much as going as further as transplant and other modalities that are available for these patients. Advanced lipid management, especially in selected patients that lipids are difficult to control. There are new whole host of new medicines, including PCSK inhibitors, which are injectable medicines that can lower the cholesterol. And then on top, there are community programs for education and support for these patients at every level to help lower the incidence of heart disease and mortality associated with that. For invasive treatment of coronary artery disease, there are EP procedures, there are defibrillators, there are pacemakers, there's ablation for selected rhythm, and there's Watchman device, for example, for selected patients and patients that cannot take blood thinners for atrial fibrillation. In terms of revascularization or improving blood flow or blockages in the blood vessels, there's stenting, bypass, there are hybrid procedures being done where certain arteries are treated best by open heart surgery and other arteries are treated with stenting. And then last but not least, treatment for STEMI patients. STEMI is a heart attack that happens acutely when an artery suddenly closes up and causes a major heart attack. And this is really an opportunity, a time to help patient lower the incidence, lower the long-term sequelae from a heart attack, and certainly lower the mortality that's essentially associated with these patients. So this is a angiography where you go in and take pictures with a catheter, most of the time done via arm approach, but also from the leg, and you go inside the blood vessel and you look and find the issues. This is again a patient with significant blockage or tightening of the blood vessel here, and then this is after fixing that with the stent. This is a patient coming in with a heart attack where an artery is completely closed up, and these patients. This is very significant because these patients are at much higher risk of having a rhythm issue or sudden cardiac death at that time. And the goal is, especially with our goal at Tanner, is to open these arteries up as quickly as we can to minimize morbidity and mortality associated with these patients. This is after opening it up with the stent and then improving blood flow in this artery in this patient. So again, at Tanner we have multiple locations. We have the rehab center, which patients go to, and I think I'll probably stop here, and we can come back and take any questions. So thank you. Thanks for coming tonight.
Dr. Khawaja, Kay actually wants to know if any of the heart tests that you mentioned, do they have to be routine, or are they routine, or do they have to present a problem to get them? Right. So there's a whole host of tests that could be done, but I don't think there's anything as a routine stress or routine test. It's based on patient risk for heart disease and based on discussion with their physician, and then the test. So there are tests that sometimes could be done to find out more if you truly have a higher risk or not. And I think based on some models, you can do, for example, calcium scoring that can be sometimes helpful in certain patient subsets. So I think the best, there's no routine test, but there may be tests that may be more applicable to a certain patient based on their risk and after discussion with their physician or provider. Okay. And then another participant asks, at what age would you recommend a screening for someone who has a high rate of cardiovascular disease within the family? Right. So that's again dependent on multiple risk factors. So that's again there's those patients they have concomitant other conditions, diabetes, high blood pressure, high cholesterol, based on their symptoms. There's not a per se screening test guideline in patients with risk factors, and this is again the guidelines would discuss tests in certain patient populations. So again, it's based on really truly physician and patient discussion. There are no set guidelines that if you are of certain age, then you should have a quote unquote a stress test or something like that. Is there a way to reverse plaque buildup? There's not. That's a great question. There are no studies that show plaque buildup, except for some studies with lipid lowering that may
prevent or that may actually halt the progression of plaque buildup. And there are some studies that have used intravascular ultrasound to go inside the blood vessel, and they've actually shown that there is some regression of plaque. So for all practical purposes, so I think there are two parts to that, because the plaque buildup is one part, but what truly causes significant morbidity and mortality is when that plaque ruptures and suddenly causes an acute event, like a heart attack, for example, that we saw in one of the diagrams earlier. So to really address that is to lower the risk factor. As you lower the risk factor, lower the inflammation, you would actually try to minimize that plaque rupture. And cholesterol, lowering your LDL certainly helps that. Statins, for example, cholesterol lowering drug, have shown not just to lower the LDL, the cholesterol, but also lower the inflammation that's associated with these plaque, and we call those pleiotropic effects of these statins, where it actually lowers the inflammation. So again, yes, you can with very aggressive lipid lowering. In some studies, it's been shown, but for all practical purposes, if you can lower the progression of plaque and certainly prevent a plaque from rupturing, that makes the biggest impact in patients' lives.
Sure. Well, that was all the questions that came through. You just got a comment that said excellent presentation. So thank you so much for joining us tonight, Dr. Khwaja.
Thank you. Thanks for having me. Appreciate it.
And Kay, we will turn it over to you.
Okay, let me get set up here. Okay. Minimize that. I'm talking to myself, sorry. Minimize that. Okay. All right, I am ready to go. Hi, everybody. So good to see you. Dr. Khwaja, that was an amazing presentation. That is so important. And I don't think people realize that that so many women die of heart disease as opposed to other cancers. It just seems like it doesn't quite get the press, but it's important that people know that. So I really appreciate your presentation. I have realized at some point in my life the importance of exercise. And now that things are kind of starting to open up, I'm kind of back to my bucket list items. And one of them, I'm trying to visit all the national parks. Now, some of you may be familiar with a hashtag called Yoga in Nature. And basically, most young people go out in nature and take pictures of themselves doing yoga. Well, I do a little yoga. So I thought, well, I could take, okay, maybe not quite as good as she did, but you do it at your level. And here you can see that she is executing a flawless downward dog. And I'm doing more of a downward frog, I think, but again, at your level. Now on this one, I was a little worried because I was standing next to a canyon and I thought, I don't want to go tumbling down into the canyon. So I think I better hang on to the rail, but I think you can agree that I nailed it. So such a pleasure to be here. We find ourselves in these unprecedented times in this new normal. And are you sick to death of both of those phrases? I know. And, we all know people who, for the most part, are happy and healthy. And times like we've gone through over the last couple of years just seem to slide right off of them. Well, it turns out they don't really exist. But people who, for the most part, are happy, healthy, and successful do share certain characteristics. They manage the stress of change by letting go of things that they can't control. I know that's so easy to do in theory, but very difficult to put into practice. They take care of themselves. They realize that self-care is not selfish because you cannot pour from an empty vessel. And they also choose positive emotions. Now, we all have ups and downs in our lives, but the key is to get back to positive emotions as quickly as possible, such as keeping our sense of humor, maintaining a spirit of optimism whenever possible, and making serenity more our default position as opposed to being in a stress response. And again, these are very difficult to do in practice, easy to do in theory. And I know the concept of optimism sounds very fluffy, but the American Heart Association did an exhaustive study and they found all things being equal, people with an optimistic spirit had better heart health, a stronger immune system, and a decreased risk of stroke. Isn't that amazing? The wonderful Helen Keller said, optimism is the faith that leads to achievement. Nothing can be done without hope and confidence. Don't you love that? She further said, no pessimist ever discovered the secrets of the stars or sailed to an uncharted land or opened a new doorway for the human spirit. You know, all the great inventors were optimists and resilient. You know, Thomas Edison tried 6,000 different elements before he developed the light bulb. You imagine trying and failing something 6,000 times? You imagine his friends around try 4,000? They're like, Tom, dude, give it up. Candles aren't that bad. Let's go shoot some hoops. He's like, no, I got to make a light bulb, 4001. Give me that cat hair, 4002. And we recognize him as the very embodiment of optimism and resiliency. But when I talk about optimism, I don't mean that we should be like these eternal optimists. You know, these people that are always on, always happy, happy, happy. Aren't they just annoying to the rest of us? We're trying to have a nice pity party. They're like, well, look on the bright side. You could be dead. So could you. One can only hope. Negative emotions are part of the human experience. Anger, frustration, fear. We all feel them. But my point is, we should allow negative emotions to be more like brief visitors and see what they're trying to teach us rather than just to move in as full-time residents. And really worse than the overly perky people are the pessimists. I call them joy busters. You know, the kind of people that can just suck the energy out of the room the minute they walk in? You just thought of somebody, didn't you? These are the kind of people, no matter how good your news is, they will find a way to rain on your parade. You can go up to one of these people and say, you're not going to believe this. I just won the $100 million lottery. And they just shake their head. You know, you're going to have to pay taxes on that. You'll be lucky if you end up with 50 million. Somehow I'll make ends meet. So I know this will not come as a shock to you, but one of the biggest causes of stress is people. People, and they're everywhere, aren't they? They're on the highway, at our jobs, in our beds. I mean, they're everywhere. But one thing I've learned, and I know you know this, we cannot necessarily control what other people say and do, can't we? No, we can only control what? Ourselves and how we react to what they say and do. People can be rude, can't they? Well, I don't have to tell you this. And I don't even know if they mean to be. They can just say the most jaw-dropping things. Walk up to some young couple, hey, when y'all get married anyway? Or a newlywed couple, when y'all having a baby? Or somebody like me, heard about your rash? I mean, it's just rude. So what can we do? Well, the main thing is to remember to keep our sense of humor. And you know what? Keeping our sense of humor is a mindset and it's a choice. It is simply deciding, I'm just not going to take everything quite so seriously. I'm going to find the humor wherever I can. There's actually health benefits to laughter. It helps improve our immune system, lowers blood pressure, reduces stress, and improves our mood. So where to find humor? It's all around. You just have to keep your humor antenna up. I know. I think that's his emotional support haircut. But if you keep your humor antenna up, there's just opportunities to laugh everywhere. And I think people are so hilarious, especially when they're not trying to be. Now, do you know people that mix up common words and phrases? My sister does it all the time. We call them Cindyisms. It's when she gets really exasperated. She'll say, Kay, I am telling you, that woman is just not the sharpest tool in the sky. What? One time we were playing Scrabble. She goes, man, I got nothing. I am up a pole without a paddle. What does that mean? But people don't do it all the time. I do it. We all misspeak. I ran into this lady that was telling me that her niece had graduated from college. She was really proud of her, as she should be. She says she's really smart too. She graduated Magnum PI. I didn't want to correct the lady and say, ma'am, everybody knows it's Magna Carta. But you have to find opportunities throughout your day to keep that mood elevated because it's so easy. But things going on around us, locally, nationally, globally, I mean, we can just be in a horrible, bad mood all the time. So we have to find opportunities to elevate our mood. Now, I live in Ohio, and there's a chain of tire stores called Tire Discounters. Every day they change their signs. I wanted to show you a few of them. Good-looking personnel, today only. Family owned. Shut up. No, you shut up. Do these tires make my lugs look fat? Sometimes I just don't get their signs. Sometimes we don't get these signs either. Slow, cop hides behind sign, and people still got tickets. They're just tires, for heaven's sakes. But they found a way to make tires interesting. I finally had to go in the store. I said, I have to ask, what is the story with the signs? The guy said, I don't know. I said, what do you mean? He goes, it's Chip. I said, who's Chip? Oh, he's the owner. Oh, by the way, I sound just like the tire guy. I mean, it's freaky. You should hear it. Chip's owner. He sits down there at the home office in Cincinnati every day. He sends an email out to all the stores. We have to change our signs. I don't know why he does it. I said, well, I know why he does it. I just walked into your store. Now, where do you think I got tires next time I needed them? Tire discounters. And now you folks, for the most part, who are Alabama and Georgia, know that Chip from Cincinnati owns tire discounters. I don't even get a discount. I'm going to find that Chip from Cincinnati and get my discount. There he is. He says, I'm way more than a pretty face. Yeah, okay, Chip from Cincinnati. But you know what? He started with one tire store. He now has over 140 stores in 4 or 5 different states. And I have to believe that his sense of humor has something to do with it. But the bigger point is, I can be in kind of a bad mood. I'm driving down the street and I look over and I see one of their signs and it makes me smile, chuckle, even laugh out loud. Now I have a choice, don't I? I can take my old bad mood from the moment before into the new moment, or I can take that little tiny uplift and just begin to shift my mood, because it truly is a choice, even though we're not necessarily aware of it. And who doesn't like a pastor with a good sense of humor? This is outside a little church in my town. Oh, wait a minute. Sorry. These signs are just a cry for help. I think we can all agree with that. This is outside the little church of my town. Pastor parking, you park, you preach. So we like people with a good sense of humor, and they like us as well. And it turns out it's good for the heart. It's even biblical. A merry heart doeth good like a medicine. We always know that laughter and keeping a serene countenance about ourselves is good for the heart. So look for those opportunities to laugh throughout your day. Now, I was paying my bills, and I still pay my bills the old-fashioned way, and they don't like it. And you can tell when they put on the outside of the envelope. Save a stamp, pay online. Then they get downright bossy. Place stamp here, pay online, log on now, relax, American Express. Then they resort to shaming. I think this is wrong. For Pete's sake, it's just you and a couple of women from the Red for a Reason event still doing this. I mean, I don't think that's really necessary. But if you pay your bills online, you can't have the kind of fun I'm getting ready to show you. Now, I was paying my bills. I was in a little bit of a mood, and I thought, I'm going to have some fun here. I got kind of tired of the same questions. I thought, I'm going to write back. They said, amount closed. I said, you're not the boss of me. Please include account number on your check. Why don't you? Amount paid. Look on the check. Now, I'd like to think that whoever opened the envelopes maybe got a little chuckle as well. And then I thought, you know what? What if we do little unexpected things? What if those of you dinosaurs like me that still pay their bills this way, what if you wrote a little note back? Just said, hey, I hope you're having a great day. Wouldn't that feel better than the feeling of, oh, here we go, another bill? And it would elevate somebody else's mood as well. So we could talk about humor in the small things in life. Do you think there's a place for humor in the more important matters of life? I really believe that there is. One of my favorite books is called Man's Search for Meaning by Viktor Frankel. Now, he was a Holocaust survivor and endured 3 years in Nazi concentration camps. And listen to what he had to say about keeping a sense of humor. He said, the attempt to develop a sense of humor and to see things in a humorous light is some kind of a trick learned while mastering the art of living. Yet it is possible to practice the art of living even in a concentration camp, although suffering is omnipresent. Isn't that amazing? Here's another one of his quotes I just love. Everything can be taken from a man, but one thing, the last of human freedoms, to choose one's attitude in any given set of circumstances, to choose one's own way. Now, one of the key components of managing our stress is to assess our level of control. In every situation we find ourselves in, we have to ask ourselves, can I control this? Do I have total control over this situation? Do I have some control, or do I have none at all? Now, here's a situation we all share. What about driving? How much control do we have? We don't have any control, do we? No, and certainly not over other drivers. And you know what? I used to weigh out the stress of not getting where I needed to be on time versus the stress of getting a ticket. You know what I finally learned? You just leave earlier. I know. It took me years to figure that out. And I had to learn it because at my age, I can't bat my eyelashes at the young cops and get out of the tickets. I'm like, you really want to give me that ticket? Like, ma'am, You got something in your eye? Are you going to be okay to drive? There's somebody we can call, maybe a son, grandson, great grandson. Just give me that ticket, you whippersnapper. I didn't think you gave tickets to pretty girls. We don't, ma'am. Sign here. Rude. But if you don't remember anything else I say today, remember this. Trying to control that which is uncontrollable is a key cause of stress and unhappiness. We cannot always control the circumstances of our lives, but we can always control how we view those circumstances. And, we've had so much change, but it's not new. We've always had change. Some of you will remember how cars used to be. They change all the time. I can remember when cars didn't even have seatbelts, but we didn't really need them. We had mom's bionic arm. She did that till I was 42 years old. No seatbelts, no car seats. You know where the baby rode in the car? In mom's lap in the front seat. Yes. When you got too big for that, you'd head over to your dad's lap and help drive the car. When you got too big for that, you'd lay across the back windshield. That will get you arrested today. Cars did not even have airbags. The only thing that happened upon collision is the glove box would fly open and a bunch of S&H green stamps would come flying out. Oh, yeah. If you remember S&H green stamps, you're older than dirt. There's your old people. Now, for you younger folks, Google search it. S&H green stamps. I think they're in museums. But times have changed. Parenting styles have changed. Oh, my goodness. It's so different now. And listen, I'm not here to pick on young parents. It is way different than it used to be back in the old days. But young parents today have so much pressure. If you take the snacks, it's got to be no GMOs, gluten-free, no nuts. I can remember my mom taking the snacks. They just lined the kids up in a row and poured sugar down their throats. It was no pressure. And my goodness, now even to ask a girl to marry you, it's got to be a 2-camera shoot and a viral video. It doesn't even count. I can remember the guy just stick the ring in your food and hope he didn't choke. I just cannot believe the pressure now on younger folks. I would revolt. I really would. Go to every game of your child's. Now listen, if it nourishes your soul to attend every school activity and you feel like that's what you want to do, then do it. But if you're working a full-time job, maybe you're one of the sandwich generation where you're looking after older parents, you've got kids, and you're feeling your stress levels just starting to bust, skip a game. That child will be okay. Oh, you'll get pushback. When you go the next week, they'll be like, Tiffany, we missed you last week. I just tell them, yeah, you know what, Steph? I was having a big old bubble bath with a beverage of my choice. What do you think of that? Yeah, I might miss next Tuesday, Steph. Yeah, I just tell them. So it's so different. And one thing that's nice is they really celebrate kids. It's graduation from preschool and kindergarten and 5th grade and middle school and high school. I got one graduation, one. You know what I got? Luggage. Yeah. It said, your job's done. Get out. But boy, parenting styles have really changed. Some of you that will recognize this stuff are cringing right now as you see this. But I have to say, kids today are a little soft. I can remember you could literally sever your arm off and your mom would just slap some of this on the nub and send you back outside. It's true. Oh my goodness. We used to drink straight from the garden hose. Oh, we were wild. But I tell you, I don't know how we made it to adulthood. I really don't. The way we ate lead paint and rode on our bicycles with no helmets, it was really kind of crazy. And again, the parenting styles were different. We were like houseplants. They fed us, they watered us, they stuck us in the sun. That was basically it. Now, one thing that has changed, or it hasn't really changed, but when a child turns 1, it's a really big deal. Well, what has changed is the celebration has escalated a little bit. Now, it used to be you just slice off a little piece of cake, put it on the high chair, and the child would smear it around, and hilarity would ensue. Well, that has escalated a bit because now the child gets its own cake. And some of you know what I'm talking about. It's called a smash cake. I know, he is adorable. And there's a $400 cake nobody's going to eat. And we all know that couple. No, I put icing on your nose. No, I put it on your nose. Ugh. It's even bled into banner birthdays. Look, Jackie Sue's 30. And I don't think the cake is the only thing that's smashed in this picture. So times have changed. Now, one thing that hasn't changed is we tend to stress about aging. And, throughout my life, I wish I was older. I wish I was younger. I got to tell you, folks, when I hit 50 and I realized that a third of my life was over, then I hit 60. I'm like, dang, my life half over. This friend of mine goes, Kay, unless you're planning to live to be 130, you're a little over the middle there, girl. One thing I don't do is try to be hip with the kids, use the lingo. Every time I've tried, it's just disastrous. Remember, everybody was doing this with the L to the forehead. I thought I was so cool. I was going around, loser, loser, you're a loser. This kid goes, yeah, you got the L backwards there. You're just basically calling people a right angle. I said, no, I'm saying don't be so obtuse. Booyah. You're getting older when you hear yourself say these words. It's 8 p.m. Who could be calling at this hour? You're getting older when a website asks for your year of birth and your finger cramps from scrolling down trying to find it. You're getting older when younger people say, why are you always mad? I'm not mad. It's just my face. It's slowly sliding off my skull and I can't seem to stop it. But thanks for bringing it up because now I'm mad. Mad face, glad face. I do have one question. I'd like to know what marketing genius decided to name a clothing line for middle-aged women Sag Harbor. What, Wrinkle River was taken? I mean, that's just mean. So change has always been with us, but it still is difficult to deal with. What happens is change challenges our current reality by forcing a new reality to rush in. And we're resistant to change because there's comfort in the familiar and fear of the unknown. So we'd rather stay where we are and not have to change rather than go through the growing pains of a change, even if we know the result's going to be better. The people who handle change the best approach it with, and there's that word again, optimism and an open mind. Sometimes if we just look at change as an adventure, again, it's not what happens to us in our lives. It's how we view what happens to us that determines our level of happiness. And if we can't control it, I can't stress this enough. We simply have to let it go. Not any parents out there or grandparents that have seen the movie Frozen about 40,000 times. Sing it with me. Let it go. Let it go. Cold never bothered me anyway. And sometimes you just have to trust that everything's going to work out. I know. That poor cat. It's like, if you could put that camera down and help a sister out, that'd be really amazing. So Dr. Kawaja talked about the many things we can do to prevent heart disease. And in terms of just our overall good health, it's a lot of the same things he suggested. The keys to good health, we know these things. The body needs exercise, maintain a healthy weight, don't smoke, keep good nutrition, get our sleep, and manage our stress. Now, none of these are easy, but even if one piece of this puzzle is missing, it can completely derail our health. And the thing to do with it, if you're suffering with 2 or 3 or 4 more of these puzzle pieces, the thing to do is take the easiest one first. Don't try to handle 2 or 3 or 4 things at one time. It's a real recipe for failure. And this is why I like New Year's resolutions. I like the idea of a reset. But the thing is, they're too big. And we say, I'm going to do this, I'm going to do this and this. Well, we just passed what is called the cliff. It's in mid-February. And it's when gym membership completely falls off. Not the membership, the attendance, because everybody joins the gym at the beginning of January. By mid-February, they've gotten 6 weeks into it. And listen, when you first start exercising, it's demoralizing. You can actually gain weight. Yes, it's the worst thing. You're sore from head to toe. And it's easy to give up. But if you stay with it, they say it takes about, ready for this, 6 months. Once you do 6 months, you begin to not only not dread it, you actually begin to enjoy it. And then there will come a time when you crave exercise like air and water. I know, I hear myself. I used to be one of these people that didn't do any of this. And now I'm one of these people I used to hate. I've become a bit of a health nut. And I'm going to talk about that in just a minute. But in terms of getting sleep, it's not easy. I know that. We're getting this in-between type season where you wake up and the furnace comes on and the air conditioner comes on at night. And I'm a woman of a certain age, so my nights go a little something like this: covers on, covers off, covers on, covers off, covers on, covers off, go to the bathroom, covers on, covers off, covers on, covers off, go to the bathroom. I saw this on Facebook. I said, man, I need me one of these. Yeah. Somebody goes, that's a man. I go, yeah, menopause. But we need to make sure to get our screenings. So many things to do with our health. And we talked with Dr. Kawaja about screenings for heart disease, that some of them aren't necessarily available unless you do present with a problem. But in terms of our overall health, you won't believe this. This is how much of a nut I've become. All of these listed there, I have had done in the last 2 months. Now, a couple of them are because of ongoing issues, such as the EGD and the knee doc. I have arthritis. I won't go into all my health thing, but I study karate. I did 11 years of karate as an adult and kind of wrecked the knees. So anyway, but all those tests I had done, sometimes the insurance pays and I feel like I'm leaving money on the table. I know that sounds really strange, but you're looking through this going, wow, oh my gosh, that's a lot to have done. Well, it is, but January tends to be a little slower for me because we're coming off of Christmas and a lot of people haven't started back up with their conferences. So I just designate that as, I call it my tune-up month. I just get it all knocked out. Now, obviously, a colonoscopy, bone density, mammogram, I don't do that every year, but I had not done those in a few years. It was time. So it just worked out that they all got done over the last couple of months. So, and pretty good results overall. But you're looking at massage. Well, what is that? Well, when people think of massage, this is what they usually think of. Well, that's massage for relaxation. That's not what I go for. I go for deep tissue massage. It is, let me tell you something. If you've ever been through, it's more like this. If you've ever had deep tissue massage, you're glad when it's done. Yeah, no, you feel much better later, but they really get in and work out those knots and things that are starting to develop problems. It's amazing to me how she can say, oh, your hip's hurting. It's probably something over here, and we'll work out all those knots and so forth. So massage has become part of my regular thing. But I mentioned that I have become one of these people I used to hate. Listen, last summer, I celebrated 30 years clean and sober from drug and alcohol abuse. I smoked cigarettes for 25 years, quit those 25 years ago. For me, addiction is like a game of whack-a-mole. You remember whack-a-mole at the carnival? I'm like, oh, you know what? I drink too much. I'm going to do drugs. I do too many drugs. I'm going to drink more. I'm going to smoke cigarettes for 25 years. Stop that. Discover the joy of sugar and carbs. Gain 40 pounds. Lose most of that. Start buying shoes online. It never ends. But I looked at my family history. It's pretty